Good morning, everybody. It is so nice to be back at Purdue. And, I know I'm a substitute speaker. And I'm not sure I'm going to hit a home run, but I'll try and get maybe a single or a double. And then Sarah can clean up for me afterwards. So, the title of my talk is a bit of a fraud because I'm going to talk mostly about physical activity. But I put healthy lifestyles because towards the end of my talk, I'm going to suggest that physical activity alone is not enough in order to assure optimal aging. But what I really want to do today is take you through a kind of evolution of thinking and research in the area of aging and physical activity over the past 50 years or so. And I believe that you can discern a number of pretty clear phases in the research. And I want to talk to you about those phases. So phase 1, 2, and 3 are related to establishing the knowledge base and making the case for the importance of physical activity and living a healthy lifestyle in general. And I'm going to make the case that that's now kind of established, and there's really good data, and it's no longer controversial. And then towards the end, I'm going to talk more about developing a public policy framework that enables us to empower more older adults to live those healthy lifestyles. And then finally talk about how the model for studying optimal aging needs to be refined and needs to be evolved in order to accommodate what we know now about the complexities associated with growing older. So, phase 1, building the evidence base. And this really, I think, can be divided into 3 major areas. The relationship between physical activity and physiological functioning, the relationships between physical activity and psychological health in old age, and then finally, the relationship between physical activity and chronic diseases and conditions. And I'm going to say just a little bit about each of these. Now, I was asked to give this talk at the National Academy of Kinesiology, which is the professional group for exercise scientists. And so I used the number of the academicians. So when you get inducted into the National Academy, you get a unique number. I think in that particular academy, there are 120 active members. And so the first member of the Academy was member number 1 in 1928. And so as I go through the literature, you'll see these little numbers there. And what that refers to is when the person was inducted into the Academy. I'm ashamed to say I do not know my number. It's something like 400 and something. And if somebody has a number that is 200 lower than you, then they're quite a bit more senior than you. So I think that the newest inductees are like around 600 now. Okay, so that explains these strange numbers. So what do we know about aging and how physical activity impacts the aging process? Well, research in that area really started in the region of about the 1950s and 1960s, where professors at universities like Purdue and Illinois began to bring in middle-aged and older adults and study what their physiological functioning and ask questions about why are some people able to do so much more when they're old than others. That led to questions about the relationship between the exercise that you do and the way that you age, and its impact on your cardiovascular system, your musculoskeletal system. And here are the names of some of the heroes of that area. So this is Herb de Vries. He was at the University of Southern California for virtually all of his career, and he was one of the first people who began taking people in their 70s and 80s and subjecting them to relatively rigorous physiological tests to determine what it is that they could do. This here is a book by David Kostal, who used to be a professor at Ball State University many years ago, and he started a research program that analyzed runners who had been active throughout their whole lives and really developed some of the early research that looked at the trajectory of decline in functioning as we grow older. And basically, the summary of this work is aging is inevitable and inescapable, and we are all going downhill with respect to our physiological performance. That's the bad news. The good news is the slope of that hill varies tremendously, and people who are able to optimize the aging process appear to be on a more gradual curve, and more about that later. Moving along. So I think the first research really looked at the relationship between physical activity and physiological health. That makes sense. But there was very quickly a realization that people who are physically active also benefit psychologically and cognitively. So my mentor, this gentleman here, Hafez Ismail, was a professor here until he passed way too early in 1984. I was his last doctoral student. But many of you may remember Marjorie Ismail, who was a really important member of this community for many years and just passed fairly recently. Well, Ismail had a very famous cover of the magazine Psychology Today, and the title of the cover was Jogging the Imagination. And Ismail did a study on the effects of jogging, physical activity, running, on creativity and imagination. And it was really in the 1970s, one of the first studies that was suggesting that physical activity may benefit you in some other ways, and not just in terms of mental health, but in terms of creativity and cognitive fluidity. And there have been, of course, a huge long literature now on the effects of physical activity on emotional well-being, on depression, on cognitive functioning. And we now know that really, yes, it is a good idea to be physically active, not only for physical benefits, but also psychological. And then the third area that research really began to focus on was the relationship between physically active lifestyles and chronic diseases and conditions. And my hometown is London, and I used to, Roseanne was right, I was a kind of a crazy runner when I was younger, and I used to race London buses. So it's a really fun thing to do because you could, they are slow and they keep stopping to let people on and off. And so you could actually run alongside a bus, and sometimes you could go 8-10 miles racing the same bus because it would go past you, but then it would have to stop, and then you catch up. And when I was training, that was one of the things that I really liked to do. And at the end, if you got lucky and you went for like 7 miles racing the same bus, you know, that would be 40 minutes or so. People would be hanging out the windows, yelling at you, and it was just a really good experience. But I digress. London buses are actually really important in public health. And the reason they're important in health because Jeremy Morris was an epidemiologist from London, and he studied bus conductors versus bus drivers, looking at evidence of mortality from cardiovascular disease. And so the bus drivers sit here all day negotiating traffic. And at the time of Jeremy Morris's study, the conductor would actually walk across all of the bus, including going up and down the stairs all day, collecting fares from the passengers. So he would have a little thing and he'd give you a ticket and collect the money. So the bus conductors had extremely physically active lifestyles, including going up and down the stairs all the time. And Morris was able to show a very, very significant difference between, in both morbidity and mortality between the bus conductors and the bus drivers. A study that was subsequently replicated in the United States by Ralph Pathenberger studied longshoremen who unloaded ships in San Francisco, I believe, and showed that people who had active jobs had significantly less chronic disease than people who were sedentary. And that led to a host of different studies that have documented a relationship between chronic diseases, diabetes, hypertension, cardiovascular disease, many others, and relationship to lifestyle, physical activity. So the first step was to establish that knowledge base. And I think that for the most part, that has been established. So when I was starting out in the 1980s, there were still people who said, well, the evidence is not all that strong, that physical activity is really all that important. But there were also people at that time who said, well, there's no real evidence that smoking is bad for you. Well, both of those questions have been put aside. And now I think we recognize, yes, it is important for everybody. So the next step was to convince all of the professionals. So not just a relatively small subset of scientists who are studying exercise, but physicians, nurses, public health professionals, and other individuals. So building consensus among professionals. And I'm going to suggest that there were three quite big events. The publication of the first World Health Organization guidelines, and then the publication of the Surgeon General report on physical activity and health in this country, and then finally the publishing of the first authoritative position stand from the American College of Sports Medicine, which is the professional organization in this area. And I was fortunate enough to be involved in all of these activities. So I want to talk to you a little bit about the Heidelberg guidelines. So Heidelberg is in Germany, a beautiful city on the Rhine, and the WHO convened a meeting there where they had 20 people from different countries representing different fields. So we had gerontologists, public health scientists, physicians, medicines, and I was representing the United States at that meeting. And essentially what they did was they locked us up in a room and they said, you can't come out until you have the draft of a consensus document. So 3 days later, we managed to come up with something that was then designed to be read by policymakers in the area of aging, articulating a reason for promoting active lifestyles. And the WHO document made the case for promoting physical activity at really two different arguments. One, the benefits for each individual person, but then also the benefits for society for promoting active, independent lifestyles. So for the individual, they pretty much reflected what I had just talked about, and those are the known benefits of physical activity psychologically, physiologically, and socially. But at the level of society, the WHO recognized what we're all now very much aware of, is the relationship between independent and healthy aging and reduced health and social care costs, enhanced productivity of older adults. So enabling older adults to maintain, to continue to be active in the workforce, whether it's for paid work or volunteer work, but extremely important. And then finally, for promoting a positive and active image of older persons. So I remember when I was a grad student, when people retired from Purdue, they gave them a rocking chair. You know, a black and gold rocking chair with the little emblem of Purdue on it. And that was sort of the expectation, that you take it easy, right? And, you know, now they probably give you a pedometer or an accelerometer or a membership to the health club, and that's a good thing. The other thing that I would note is that much of the early work that I talked about focused on healthy, active older adults. So in the 1950s and 1960s, if you wanted to subject a 75-year-old person to a treadmill test, you typically went and got a jock who had stayed active for their whole lives, and you were really studying only this end of the continuum. And over the years, as our research sophistication has increased and our ability to study different populations, we now have evidence that healthy lifestyles are really important across the continuum. And it's not just something for people who are athletes or jocks, but it's really something for everybody. And then finally, the document said that we are going to need public policy that recognizes the importance of living a healthy lifestyle. And it isn't just an individual choice, but we're going to need to plan for this with policy, with legislation, with environmental change. And given that that was 20 years ago, I think that was quite a prescient statement to conclude the WHO guidelines. So, first step was establishing the knowledge. Second step was building consensus among professionals. The third step was educating the public and building consumer demand. So the experts knew it was good for you, but the average person was still sitting in their rocking chair. And we needed to empower them to get up from that rocking chair and go for a walk. And so there was a fairly substantial campaign led by the World Health Organization that focused on active aging. And in 1999, which was the year of the older person, the United Nations Year of the Older Adult was 1999, I was really fortunate. I was on the committee at the UN for the United Nations for publicizing that. And I could take a sabbatical. And every country in the United Nations had some kind of official government event for the Year of the Older Person. And so our committee members divided up all the countries, and each of us got to go to about 30 different countries to represent the UN at these events. And I had a blast. So I took my sabbatical, and I was just hopping around the world, meeting people, and it was really a lot of fun. But I want to talk to you about something called the Global Embrace. And this was a chain of locally organized sponsored walks circling the globe in 24 hours. So the first time zone is in New Zealand, and then if you go around the world, there's 24 time zones. Well, the WHO managed to organize sponsored events in every time zone around the world, but more importantly, they managed to get it on CNN, on Deutsche Welle, on the BBC, and get images of older people being active. So in Rio de Janeiro, they had samba dancing on Copacabana Beach, for example. And it really was the beginning of some concerted public health campaigns to present images of older people being regularly physically active. This is Victor Matsuda, who is a Brazilian public health physician who started a program called Agita São Paulo, or São Paulo Move. And Agita São Paulo got adopted to be Agita Mundo, and, which means the world moving. And it was one of the first campaigns to promote active lifestyle for people of all ages. Now, in the United States, we have also begun or have been working in that area. This is a campaign from the Administration on Aging called You Can, Steps to a Healthy Aging. And what I think is important about this program is it began to link physical activity with other health behaviors. So this was a nutrition and healthy aging campaign. And you're going to see for the rest of the talk that there's an increased focus on integrating multiple health behaviors, recognizing that probably a single behavior isn't optimal if we want to age successfully. Can I use that term, successful aging, Ken? I use it anyhow. Okay, so I think those three phases are done and dusted. That doesn't mean that we don't need more research. It doesn't mean that there's not more questions. It doesn't mean we need to stop convincing the general public. But I think for the most part, we know the benefits. We've convinced the professionals, and most members of the general public in many countries know that physical activity is good for you and they should be doing it. Now, that doesn't mean to say that they've changed their behavior, and we'll talk more about that. But I think for the most part, we figured that out. Now, these next items, I think, are much more challenging, and we're just scratching the surface. Okay, so point number 4 is building a public policy framework to enable people to make healthy and active choices. So in 2002, the World Assembly on Aging is a United Nations event where governments are asked to send the minister with responsibility for aging and older adults to a summit meeting. And so approximately 200 individuals from 200 countries with responsibility for older adults gather together for a 5-day event that looks at issues related to aging and aging policy. And for every World Assembly on Aging, the World Health Organization is asked to prepare an agenda related to health, okay? And in 2002, the WHO focused on a policy framework for active aging. And at that time, I was involved with the WHO group in Geneva, and so I was involved in the preparation of that document. And essentially, what the document argued, and many of you may have seen a figure like this. Imagine that this is aging or time across this axis here, and that this band here or this line here represents some threshold of disability, and that when you drop below that band, you have some level of functional impairment. It might be physical functioning, it could be cognitive functioning, but we're just talking general terms here. And for many functional variables, you see an increase in capacity during childhood and adolescence, and some peak level of functioning as a young adult. So that would be true for measures like bone mineral density. It would be true for measures of cardiovascular function. Actually, many, many different measures of functioning. And as we grow older, we observe a decline in functioning. When that decline starts will vary from variable to variable. For some variables, it's most pronounced, let's say, in middle age or after menopause. That varies. But this concept of a fairly linear decline is standard for many physiological measures. And if you look at this yellow line trajectory, this is the trajectory that unfortunately many adults in our society follow today. So when they're in late middle age, early old age, perhaps 65, perhaps 70, they're right at this disability threshold. And medicine does a pretty good job keeping people alive for another 10 or 15 years, but it does it at a relatively low quality of life. Now, this trajectory here is the trajectory that we would want to be on if we had a choice, because while there's still a decline, the person at death is still well above the disability threshold. And understanding how to shift people from this curve to this curve and that difference is really a significant component of research today in the area of healthy lifestyles. Trouble is, it's complicated, right? I think we realize now it's not about whether you sign up for a Zumba class or you do Tai Chi 3 times a week. But really, there are so many different variables that could impact what happens to you as you age. And they're not, I mean, some of them are personal characteristics, some of them are economic, some of them are safety, some of them are access to health care, and that some of them vary tremendously by gender. So, you know, when I was doing my sojourn around the world, I would visit places like Saudi Arabia and Kuwait. Are there differences between genders in the way people age in some cultures? Absolutely, you know. And so recognizing that there are multiple determinants of aging is really important. And I think you'll see that most of the most influential studies today involve teams of researchers looking at a combination of different outcome measures from a variety of different perspectives. And the idea that a single scientist or a single discipline is going to answer this anymore, I think it's almost disappeared. So what my own work moved into was coalition building. So Roseanne mentioned that I was a PI on a grant that from the Robert Wood Johnson Foundation that linked 50 national organizations to try to develop a coherent national strategy in the area of promoting physical activity that involved government agencies, universities, non-governmental organizations, as well as private sector companies. And I think that's the way of the future. And so in the area of aging, I'm proud to say that the coalition building that occurred, probably because of the support of AARP and the Robert Wood Johnson Foundation, actually set the course for development of government guidelines in physical activity for the whole population. So we crafted a blueprint for the 50-plus population, and then that was adopted by the CDC and the Department of Health and Human Services for the crafting of physical activity guidelines for the first time in the United States in 2008. And I think that over the last 10 or 15 years, we've seen a paradigm shift from telling people what they ought to do to suggesting active choices and active options that people might like to follow, okay? So the DHS guidelines that we currently have don't talk about exercise, but they talk about physical activity. And they don't differentiate between people who go to gymnasium and people who live active lifestyles. And there's a wonderful website that you might want to go take a look at. This is from the Department of Health and Human Services called Be Active Your Way. And it talks to people about thinking about how you would like to build physical activity into your everyday life. And it has a section 1, getting started, making physical activity part of your life, keeping it up, stepping up, being active for life. And I think that if we're going to get more than 25% of the population to meet the physical activity guidelines, we're going to have to change our approach and stop telling people what they should do and start working with them to identify things that they like to do and using some of the principles of behavioral change science in order to help people do the things that they really want to do and try to help them make active and healthy choices. So the final stage is I've called refine, expand, and evolve the model. And really what I mean by that is that it's clear that physical activity alone is not enough and that we really need to look at multiple behaviors simultaneously if we're going to make a difference. And I had a chance to work on a couple of projects with the WHO that reflect this. And the first one is the Global Age-Friendly City Guide. And I want you to imagine that you are 85 years old and you've just been to visit your physician and she's told you, you need to get out and walk more. So there you are, you're here, and you want to cross the street. And maybe you don't move too quick anymore. Maybe you have a cane or a walker. Well, it's kind of a daunting experience, right? So we've begun to think about what we can do to change our environment. So now many, many streets in the US have much better constructed crosswalks that have countdown timers associated with them. In many cities now, if you're an older adult, they'll give you an RFID device that will send a signal to the countdown timer and give you a little bit more time to cross the street. Now that's good, right? Can you imagine your self-efficacy about getting across that street if you know it ain't gonna change when you're halfway across? That's good, right? But I mean, ideally, wouldn't it be nice if there was a reason to cross the street? Like a cafe or a store to do your shopping in and so on. My mom lives in London. And before I had young kids and my wife banned me from traveling anywhere further than Purdue, I used to travel the world and give them talks and things like that. I would always make sure I went through Heathrow because my mom lived 15 minutes from the airport and I could get in, go have breakfast with her, get back to the airport and get on a flight wherever I was supposed to go. And I did that a lot. And one morning I was having breakfast with my mom and the doorbell rang. And my mom said, go see who that is, Wojtek. So I got up and I opened the door and it was an Indian gentleman. And he looks at me, he goes, oh, Wojtek, you're here. I was worried because your mom hadn't stopped by to pick up her milk. Okay? Now think about that. That was the grocer from the store on the corner of the street. And at that time, a 75-year-old lady who lived alone hadn't stopped by because she always used to walk to the store. Gotcha. Used to walk to the store to get her groceries early in the morning. And he walked down the street to just check that she was okay. Now, there are so many messages in that little story that it's hard to decompose them. It's all about community, but it's also about the ability to physically walk to a store. So my mom now is 85. She still lives alone. She fell and broke her hip, and so she's had a partial hip replacement. And she likes to go to church every day. And so this is how she does it. She says, well, I walk to church. It takes me about 25 minutes, and it's downhill. And then I do my shopping, but I catch the bus back up the hill. Okay, so she's engaged socially. She's getting physical activity, not exercise, by the way, walking, pulling a little shopping cart to put her stuff in. Public transportation is free for older adults in London. So able to use public transportation to enable her to age in place. What a fabulous story, right? And contrast it with this, okay? This is what much of suburban America still looks like today, okay? And so you have this house here was somebody's dream home, right? They moved in the 60s, and it was quiet and it was safe. And then by the time 2000 went away, the kids are all grown and left and working in Los Angeles and San Francisco. And then, you know, the husband passes and the widow's living in the house, and their kids say, well, Mom, maybe you shouldn't be driving anymore. And she's a prisoner now in her beautiful home because zoning codes wouldn't allow shops in the neighborhood because they didn't want buses going down through their beautiful streets. And so many of our neighborhoods are constructed in a way that is actually prohibits people from making active choices. And there's a huge movement looking at what would it take to make environmental changes that would support people of all ages. So a neighborhood like this with curb cuts for wheelchair users, with shading, with sidewalks on both sides of the streets is really good for people of all ages, not just for kids. I kind of want to finish up by talking about a report from the WHO about falls prevention. Okay, falls are a big deal, right? And oftentimes you hear people talking about, well, get into a Tai Chi or a balance class and you're less likely to fall. Well, that's not exactly true, because people fall for multiple reasons. They fall because of poor vision or sensory problems. They do fall sometimes because they're weak and they have low physical activity levels. They fall because of environmental hazards in the home and outside. And they fall because they're taking 16 different medications that interact with each other because their doctors don't talk to one another and they're overprescribing. And I guess the point is, you can't really address any one of these without thinking about the others. So I want to finish up by just making some recommendations for the future. The first one is we need to develop comprehensive strategies for healthy aging across the life course. Because although I've been talking about older adults, if we don't make sure that our children and middle-aged people accumulate as much functional capacity as they can get, then we're going to really have problems when they grow older. Because medicine will keep them alive, but that's about all. We haven't got good medication to improve or maximize functional capacity. Secondly, we need to design and deliver culturally appropriate multi-component intervention strategies to help people make active choices. So the CDC fall prevention literature. Take a look at this. This is in English. This is in Spanish. This is in Chinese. And we need to be thinking about, as we live in a multi-cultural society, we need to be thinking about what's going to play in this community and how do we need to change it or tweak it in order for it to be more relevant to a different community. So we need to continue to build and empower multi-sector coalitions. The idea that a university is going to solve the problems in the area of aging, or that we're going to be able to do it only depending on government agencies, we're going to have to somehow find ways to work together. We need to increase our ability to predict age-related declines in functioning. So we need to be able to measure somebody like Roseanne, a healthy 60-year-old, and predict where are you going to be 25 years from now, and where should we intervene now if you have risk factors that potentially we could impact on and lead to a better quality of life. And that raises issues related to biomarkers and understanding genetic predictors of change in individuals. There's no shortage of research questions we need to know about. So we need to know more about the prevention of chronic diseases and conditions in old age. We need to know about what measures will enable us to know who is an individual at risk and when to intervene. Oops, sorry, wait a minute, what am I doing? Here we go. We need to know a lot more about cost effectiveness of interventions. We don't want to spend a fortune on interventions that don't have a good return on the investment. And we need to know a lot more about legislation and public policy and do research on policies that work. So I've tried to give you a sense of an evolution of how we view the topic of active aging. I'm actually pretty optimistic. This particular paper was published last year in Kinesiology Review, so any of you grad students who are interested in looking at some of the references, I would encourage you to go get the paper because everything is referenced there. You know, this is Lucas, Lulu, this is Sophia, Soso, and this is Mariana. I think that if we attend to some of the challenges that I've talked about in this talk, when they grow older, do not have to necessarily follow the patterns of inactivity and premature chronic diseases and conditions that characterizes so many of the older adult population today. Thank you very much. I'd be happy to take your questions. So did I make it to first base? No, I mean, sorry, I wasn't fishing for a compliment. I was just trying to be funny. All right, so questions, please. Yes, sir.
I'd like to make a comment rather than a question about a book recently published which is called Stand Up.
Mm-hmm.
And the theme of the book is abandon the sit-down desk and go to a stand-up desk, and if possible, even at a treadmill at a speed of about 1 mile per hour. And I don't remember the name of the author, but I happen to know he's on the staff of Mayo Clinic. And apparently this was tried with a company in Minneapolis with a good degree of success.
I have a treadmill desk. I don't have a chair. I do. I don't have a chair. And we are having a conference this year at the University of Illinois this month on standing and sedentarism. And I think it's a hot research topic. There's now growing evidence that sitting, independent of physical activity, is associated with risk factors for a number of chronic diseases and conditions. So one of the things that I do when I get to my hotel room, when I travel, is I try to figure out how I make a standing desk. So last night, I got into this room at the Union Club, and I looked around me. Oftentimes, they have a futon that you can put on a desk, and then it's perfect. They didn't have that. Sometimes they have a coffee table that you can stick on top of the desk, and then you can stand. They didn't have that. But they did have a chair. So I picked the chair up, put it on top of the desk, and I did my email. You know, when you're a dean, you just get inundated with junk email, which you have to respond to. So I did my email last night standing because I personally believe that that's important. Is the literature there right now to make recommendations in that area? I don't think it's been studied enough that people can make that definitive a statement. But there's a lot of people who agree with you. Sir, you were going to have a question?
Yeah, I remember Ishmael quite well. I'm only 82, and every morning I meet with my friends. It's interesting that the friends that I meet with have been involved with what you're suggesting as an interactive, systematic way of living. Right? We know frequently that those who have not followed this are no longer with us.
Yeah.
Okay. Now, what to do between now and then, I don't know. I remember Yeshua saying, use it or lose it. Okay. Run slowly. It makes people feel good when they pass you. All right. And what I want to do is what to do next. There is, and I did not find much in what you said about the weight issue problem that destroyed Egypt in yesteryear, but we are now approaching that. I would like to suggest to you, please, sir, to figure out how to not embrace and try to bring everything down into your territory and help people expand into other territories in solving the problems you're addressing. Thank you for being here.
No, and I would agree with you, actually. There's a feud, a very active feud between the nutrition researchers and the physical activity researchers, and has been for many years. So there was a physical activity branch and a nutrition branch at CDC. They were forced to merge together. And it was, frankly, a clash of cultures in many ways. And I couldn't agree more. I think that, yes, we should bring these disciplines together, and that healthy eating. Well, absolutely. And there's probably not one answer. And I think the problem is that we have, for many years, been thinking through, well, we need to find the solution and then educate the public about it. And that works for 20% of the population. But most people don't like to be told what to do by people in white coats or, university professors. And so we need to try to figure out, what it is about a healthy lifestyle, what it is about nutritional behavior, about physical activity behavior that people are willing to do, and come up with a menu of choices. It's sort of like if you went to a restaurant that only had one dish, how many times would you eat there? But if there was a menu that had a restaurant that had a rich, deep, and complex menu, you might go there more often. And I think that's what we need with regard to lifestyle. Yes, ma'am.
I agree with you that people don't like to be told by people in white coats what to do. And there are several of us that are teaching our future health professionals. So what would your advice be on what we can do in curriculum to help advance this area and help our patients do some of those things?
Well, there's a huge literature on behavioral health and behavioral change, on motivational interviewing, on goal setting, on self-efficacy building, and I don't think that anybody should graduate from an institution who is going to be working in a health-related field without having a thorough understanding of that. I think that would help, and I think for the most part we're beginning to do that. Ken?
If I can just piggyback on Tim's comment. So we're pretty good about starting things. We start diets, we start exercise programs, we start maintaining the level of activity, and perhaps the things that threaten or interrupt are good intentions.
You know, I was doing the wrap-up talk at the National Academy meeting just a few weeks ago, and they were talking about interventions, and they made the point that we know so much more about helping people to initiate behaviors and much, much, much less about sustaining behaviors. I think part of it is related to individualized goals. You know, let me give you an example. Before I obviously got married late in life, and because I have these little munchkins and I shouldn't have them. I'm 60 years old. I've got a 2-year-old girl, so you do the math. But I used to love to go to the gym. I was a crazy exerciser. And for me to go to the gym, if it wasn't 2 hours, it wasn't worth it. You know, so I was nuts. I was obsessed with it. And, you know, for my wife, she'd say, "You want to go to the gym?" I'd say, "Yes." And we'd go, and 15 minutes later, she said, "Are you ready?" And you know, that wasn't going to work, you know, because however long she was willing to stay was never long enough for me. And once I had kids, I realized I'm never going to go to the gym again for the next 10 years. So I thought about it, and when I was a kid, I grew up in London, and my school was 3 miles away from home. And every day, I'd walk to school. I used to like to play football or soccer in the playground. And I figured out that if I ran to school, I could get to play football for longer before the classes started. And so I never thought about exercise. I mean, this was 1960s, right? I never thought about exercise. I just thought about, well, I'm getting to school. And then I realized, well, I actually live 3 miles from the university. Why don't I just walk or jog to school and jog home? And so, you know, it takes me about 25 minutes to get to work. I wear my backpack, and I'll wear a t-shirt, and actually wear shorts that I can put my cell phone in, so that if something goes wrong with the kids, I can turn around and go back, or something like that. But it takes me 25 minutes to get there. By the time I get to work, I'm awake, which is good. And by the time I get home, I've forgotten about all the, crap that went on in the dean's office. And you know, looking at my pedometer, I got lots of steps in, but I'm not exercising. I'm just kind of, I don't want to be commuting or something. But I had to make a change. Well, we're talking about sustaining a behavior, not the same behavior. The goal was to be active, but to recognize that the way you do that might change with your time, with your interests, with your hobbies, you know? And empowering older adults to make those kinds of choices, you can't do that if you prescribe things that you think they need to do. What you need to do is talk to people and empower them to make those choices for themselves. Are we out of time? Oh, we're still going. Anybody have another question? Yes, ma'am.
You try high meat, low carbohydrate, and it works for a little while, and then it doesn't.
Yeah.
And then you go for high carbohydrate and low meat, and then you try no sugar, and then you end up cheating. I don't know. How do you explain that paleo works for some people, and for people like me, if I don't eat carbohydrates, I cannot get out of the bed?
Yeah. You know, there's a really interesting TED talk that is talks about the rule of thirds. And it's about if you take sort of the population for many, many variables. Let's say, for example, Oh, I don't know, anything. Calcium and blood pressure. Okay, no, let's say, for example, being active, going for a walk by yourself versus being active in a community, in a group, or something like that. A third of the population loves one way of doing it, a third of the population likes the opposite way of doing it, and a third is kind of ambivalent in the middle. I think that's true for a lot of different things, for diets, for different types of physical activity modes. And I think that people can switch. So they can be people who really like this way of doing it, and then all of a sudden they change and they want this way of doing it. I think that used to be called the Hawthorne effect, right? You make a change is good. And so for me, weight gain has always been about calories in and calories out. You know, you just gotta watch how many calories you have. I try to eat a balanced, reasonable diet, but I don't go crazy about it, you know? And I don't know that there's an answer. I don't think going to the library and reading books is a good strategy. I mean, book reading is good, but as a way to find your own path, I think looking inwards rather than outwards might be a equally productive strategy. Yes? Yes. Mm-hmm.
Because if I look around at his year,
Uh-huh.
a lot of us are seniors. Why don't you put up senior citizens exercising?
Mm-hmm.
And this is not the only like to do. Forget about it. What do we want? Pictures of the old, only retired people? They'll scare the young people away.
Mm-hmm.
And so I'm curious to see where there are really good pictures of seniors. I mean, Marilyn Monroe was dead for how long? And there's a picture of Marilyn Monroe, you know, something fire in this place. And I think, she's not here, she hasn't been here.
Yeah.
I've been here working it out in the dark, in the morning, and I was very interested to see what there are.
Oh yeah, there are. And I would point you to a couple of resources. AARP has some good resources that show images of active older people. And there's also actually an industry group called ICAA that has collected a number of posters of images of active people. For a while, I was chairman of the board of directors of the American Council on Exercise, which is a group that accredits personal trainers and fitness professionals all over the country. And I remember talking to the president of that group about the images that they were using in their literature and how we needed to make sure that those images were diverse, not only in terms of race and ethnicity, ability and disability, but also age. And I'm proud to say that they were able to figure out how to do that. And I agree with you that it's important.
Because one of the most striking television commercial images I've seen that has stayed in my mind is that, what is this librarian, I forget what she's advertising by. The librarian used to go by and because she saved a lot of money, now she's hang gliding behind. And she's having, you know that commercial? She's having such a good time. I mean, it has to look like fun.
Yeah, I couldn't agree more. I would just make one comment. 5 years ago, I threw away my television, so I don't see commercials anymore. Okay, we don't have TV, and you don't see commercials. And that is really different, you know, because people come to you and say, well, which brand would you prefer? Well, we don't see brands, at least not in the way that most advertising works. And that's something that I think increasingly people are becoming what they call cord cutters, right? People who we stopped doing that because we've got young kids, we never watching TV anymore. And we're paying $180 for a cable bill, and we would never watch TV. And we thought, well, this is stupid. And we got rid of it. But it raises an interesting issue about how our behaviors are influenced by people who want us to buy things, you know. And if you cut yourself out of that arena, I mean, you don't get too many commercials when you're reading the New York Times or the Chicago Tribune on the web, because even though they might be there, you don't pay attention to them. Yes, and we have a person under 50 asking a question. That's a good thing.
Actually, I'll bring it back down to the younger side of the spectrum, I guess, if possible.
Okay,
I personally don't have a TV either, so that's
good for you.
in the
Yeah.
same vein. I was actually wondering, there's kind of a, I don't know if you noticed, but there are extra appendages that have been kind of added to the society these days, like the cell phone. And you see people walking around and kind of like not engaged in anything. How do you propose, besides kind of banning while walking around to actually kind of maybe harness the technology?
Yeah, it's a double-edged sword, right? I mean, I have a watch, and I have another watch. This is like my Joe 90 watch. That was a comic show from England, I think, but it has my steps in it, right? 10,000 steps. That's quite a bit for 10 o'clock in the morning, right? But I'm addicted to steps, you know, measuring steps. So I have it on my watch. I also have a little Fitbit here, just in case my watch stops working. I'm nuts, right? But there are many, 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 many people in the country who are tracking this now, maybe on their phone, that does just as good a job as your pedometer or your accelerometer. And I think that there is a whole area, a burgeoning area of health technologies, and not just looking at physical activity tracking, but looking at home safety, looking at access. My wife did a PhD in Japan, and in Japan, they have these fancy toilets that, you know, they're really complicated electronic devices. And there's a device that measures the glucose in your urine stream and calls your doctor if there's a problem. Well, I don't think that's going to sell well in the States. But could you imagine going to the bathroom and then your toilet calls your doctor to let him know? But there are also, I mean, at Illinois, we're doing a lot of work on healthy homes. Homes that measure how long it takes you to walk from your bedroom to the toilet or to the bathroom for people who live at home, or homes that are smart homes for dementia sufferers and stuff like that. I think it's just the beginning. And yes, there are problems associated with being over-related to technology, but there are also lots of opportunities and solutions. So I think that your generation is going to be the one that figures that out.